1. How HPylori screening could prevent 75% of stomach cancer cases. 2. Helicobacter pylori, the silent killer causing 12 million cancers. 3. H. pylori linked to millions of stomach cancer cases. How screening can help. 4. Stomach cancer breakthrough. How a common infection causes 12 million cases. H. pylori alert. 1. How H. pylori screening could prevent 75% of stomach cancer cases. Imagine a world where 3 out of 4 stomach cancer cases vanish overnight. That's not fantasy. It's the staggering reality revealed by groundbreaking research showing how a common bacterial infection holds the key to prevention. Here's the shocking truth. Stomach cancer rates are climbing among young people globally, yet 75% of future cases could be stopped through simple screening and treatment. At the heart of this crisis lies Helicobacter pylori, a widespread bacterial infection that's the single biggest known trigger for gastric cancer. The game changer? This risk is completely preventable through an accessible combo treatment. Antibiotics paired with proton pump inhibitors, PPIs, which reduce stomach acid production. But here's where it gets controversial. Despite having this powerful prevention tool in our hands, diagnoses in people under 50 are mysteriously surging, a trend that defies logic when we have the solution. Groundbreaking research from the WHO's International Agency for Research on Cancer projected future stomach cancer rates using sophisticated modeling. Their simulation for people born between 2008 to 2017 predicts 15.6 million global cases without intervention. The jaw-dropper? A whopping 76%, nearly 12 million cases, traced directly to H. pylori infections. Regionally, Asia faces the heaviest burden with 10.6 million projected cases, followed by the Americas, 2 million, and Africa, 1.7 million. Now the hopeful part, implementing H. pylori screening and treatment could prevent up to 75% of these cancers. Even programs running at 80 to 90% efficiency would still stop 60 to 68% of cases. And this is the part most people miss. These programs aren't just effective, they're surprisingly affordable, even in lower-income nations. Researchers compare their cost-effectiveness to proven vaccination campaigns like those for HPV or hepatitis B. But here's the controversial twist. Why aren't we acting faster? The study exposes uncomfortable gaps, especially in lower-income countries where poor data collection might hide the true scale of the crisis. Africa's spotty cancer registries likely mean we're underestimating the problem. Critics might also question the model's assumption that H. pylori rates won't change over time. Could factors like diet or urbanization shift these projections? Researchers are urging a radical shift. Prioritize H. pylori eradication through tailored programs. Wealthy nations might use endoscopy screening and insurance-backed treatment, while lower resource areas could adopt population-level screening and early intervention. The ultimate solution? Investing in an H. pylori vaccine. This study delivers an urgent wake-up call. We're sitting on a proven life-saving strategy against a cancer threatening our youth. But here's where you come in. Do you believe governments are moving fast enough? Should H. pylori screening become as routine as blood pressure checks? Or are we overlooking hidden barriers to implementation? Share your take below. Let's debate how to turn this science into action. 2. Helicobacter pylori, the silent killer causing 12 million cancers. This shocking link will change your view of stomach health. A hidden bacteria most of us carry without any clue may be responsible for nearly 12 million cancer cases in one generation. A study published in Nature Medicine warns that over the course of their lives, 15.6 million people born between 2008 and 2017 could develop stomach cancer, and 76% of those cases may be triggered by the common bacterium Helicobacter pylori. Stomach cancer ranks as the 5th most common cancer worldwide, claiming around 770,000 lives each year. And yet many patients discover the disease only when it's too late for effective treatment. And this is the part most people miss. H. pylori infections usually start in childhood and often remain entirely symptom-free. You can carry the bacterium for decades, unaware of its presence, until it silently damages the stomach lining or leads to ulcers. The infection spreads easily, through simple acts like sharing utensils, kissing, or close contact with vomit or stool. Yet it rarely raises alarms until serious complications arise. But here's where it gets controversial. The researchers project that, unless we act, 11.9 million people worldwide born in that decade will receive a stomach cancer diagnosis attributable to this single bacterium by the time they reach their mid-80s. Asia bears the brunt of this burden, with about 8 million cases expected. Even regions with historically low rates like sub-Saharan Africa could see a six-fold increase in H. pylori, linked stomach cancer by 2101, driven by population growth and aging demographics. Researchers at the World Health Organization's International Agency for Research on Cancer, IRC, examined data from 185 countries in 2022. They emphasized that, despite imperfect data from lower-income nations, the trends are clear enough to demand global action. Dr. Jean-Young Park, who leads IARC's gastric cancer prevention team, warns that without coordinated prevention strategies, health systems everywhere will struggle under a mounting wave of stomach cancer cases. Here's a simple example. In parts of East Asia where H. pylori screening and eradication programs have been piloted, infection rates, and subsequent cancer risk drop significantly. Imagine rolling out a similar approach globally. According to the study's analysis, targeted screening and prompt antibiotic treatment could slash H. pylori related stomach cancer cases by up to 75%. Contributing factors and prevention strategies. Most experts agree that improving sanitation, ensuring clean water, and educating communities about transmission can reduce new infections. But when it comes to eliminating existing H. pylori reservoirs, opinions diverge. Should we invest heavily in widespread screening programs, using breath tests, stool antigen checks, or endoscopy for confirmation? Or is it wiser to prioritize antibiotic stewardship and research into vaccine development to avoid fueling drug resistance? Controversy and comment hooks. Some clinicians argue that mass antibiotic treatment could accelerate antibiotic resistance, creating new public health challenges. Others contend that the immediate benefit of preventing millions of cancers outweighs that risk. Which side do you support? Limitations and the road ahead. The study's authors acknowledge gaps in data quality, especially in lower-income regions where cancer registries are incomplete. Despite these uncertainties, the projected figures highlight an urgent need for action. Whether through national screening campaigns, improvements in sanitation infrastructure, or investments in research for new therapies and vaccines, the message is clear. Waiting is not an option. But here's where it gets truly contentious. Should governments mandate H. pylori testing for all children, or leave it to individual choice in healthcare providers? And who should foot the bill? Taxpayers, private insurers, or international organizations? Thought-provoking questions for you. Do you think global health authorities should prioritize H. pylori eradication programs, even if it risks accelerating antibiotic resistance? What's more important? Investing in sanitation and education or launching mass medical screening initiatives? Share your thoughts, experiences, and counterarguments in the comments. Your opinion could shape the debate on preventing millions of future stomach cancer cases. 3. H. pylori linked to millions of stomach cancer cases. How screening can help. Imagine a silent threat lurking in your stomach, one that could be responsible for millions of cancer cases worldwide. Yet most people have never even heard of it. This isn't a rare virus or a mysterious toxin. It's a common bacterium called Helicobacter pylori, or H. pylori for short. Experts are sounding the alarm, warning that this tiny organism is driving a staggering number of stomach cancer cases globally. But here's the good news. Simple screening could be the key to saving millions of lives. Curious? Let's dive into this hidden health crisis and uncover why it's sparking both hope and debate. Researchers from the International Agency for Research on Cancer, IARC, a branch of the World Health Organization, have made a jaw-dropping prediction. If nothing changes, approximately 15.6 million people born between 2008 and 2017 will face a stomach cancer diagnosis at some point in their lives. That's a number so large it's hard to wrap your head around. Think of it as the entire population of a small country, all facing this devastating disease. And here's the part most people miss. A whopping 11.9 million of those cases, 76%, are directly tied to H. pylori infections. In other words, this isn't just a random health risk. It's a preventable crisis waiting for action. Now let's talk geography because this issue doesn't affect everyone equally. The vast majority of these future stomach cancer cases are expected to hit Asia hardest, with countries like India and China bearing the brunt. Picture this. Out of the global total, Asia alone could see 10.6 million cases, making up 68% of the projected diagnoses. Meanwhile, the Americas are looking at around 2 million cases, Africa at 1.7 million, Europe at 1.2 million, and Oceania at a much smaller but still significant 70,000. These numbers highlight a stark reality. Stomach cancer is a global problem, but its impact is deeply uneven, often hitting regions with fewer healthcare resources the hardest. So what exactly is H. pylori and why is it such a big deal? This bacterium is a sneaky invader that sets up shop in the lining of your stomach. It's surprisingly common. Experts believe it can spread from person to person, possibly through close contact, or even sneak into your system via contaminated food or water. For many people, H. pylori is like an uninvited guest who overstays their welcome but doesn't cause much trouble. You might never even know it's there. But for others, it can lead to nagging symptoms like indigestion, bloating, or nausea. Symptoms that are easy to brush off as just a bad meal or stress. And this is where it gets controversial. While H. pylori doesn't always cause problems, when it does, it can be a silent trigger for serious diseases, including stomach cancer and even a type of blood cancer called non-Hodgkin lymphoma. Scientists are still piecing together the puzzle of how this happens, but the link is strong enough to raise alarm bells. Here's where things get practical. Detecting H. pylori is easier than you might think. Doctors can spot it using a simple blood test, a breath test, where you breathe into a device after drinking a special solution, or even by analyzing a stool sample. If it's found, the standard treatment is a course of antibiotics to kick the bacterium out of your system. But here's the catch. Not everyone with H. pylori needs treatment. For many, it's harmless and overtreating could lead to unnecessary antibiotic use, which brings its own risks, like antibiotic resistance. This is a hot topic in the medical world. Should we treat everyone, or only those at high risk? What do you think? Now let's zoom in on the big idea that's got experts buzzing: prevention. The researchers behind this study are pushing hard for governments and health organizations to invest in widespread screen and treat programs for H. pylori. The logic is simple. If we can identify and treat infections early, we could slash the number of stomach cancer cases by up to 75%. Imagine that 3 out of every 4 potential cases prevented just by catching this bacterium early. For example, a country could set up routine screening programs, much like we do for cholesterol or blood pressure, to catch H. pylori before it has a chance to do harm. But here's where it gets controversial. Not everyone agrees on how to roll this out. Some experts argue that mass screening could be costly and might not be practical in every country, especially in low-resource areas. Others say it's a no-brainer, given the potential lives saved. What's your take? Should we prioritize this globally, or focus on other health issues first? Interestingly, not all the news is grim. In places like the UK, stomach cancer rates are actually on the decline. According to Cancer Research UK, cases have dropped by 26% over the past decade, and they're expected to keep falling through 2040. Dr. Rachel Orritt, a health information manager at Cancer Research UK, points out that while H. pylori is a real risk factor, it's not as common in the UK as it is in other parts of the world. She also emphasizes that in the UK, other preventable factors like smoking, obesity, excessive alcohol, and poor diet are bigger drivers of cancer overall. This raises an important question. Should countries tailor their cancer prevention strategies based on local risks, or is a one-size-fits-all approach the way to go? It's a debate worth having, and I'd love to hear your thoughts in the comments. To understand the scale of this issue, the researchers behind this study, published in Nature Medicine, looked at stomach cancer data from 185 countries in 2022. They combined this with projections of future deaths to paint a picture of what's coming if we don't act. Their findings are a wake-up call, but they also offer hope. Screening and treating H. pylori could be a game-changer, especially in high-risk regions. Dr. Jean Young Park, who leads the gastric cancer prevention team at IARC and co-authored the study, is passionate about this. He's urging health authorities to make stomach cancer prevention a top priority, starting with pilot projects to test out screening programs. Think of it like a trial run, small-scale efforts to see what works before rolling out bigger initiatives. Before we wrap up, let's talk symptoms because awareness is key. Stomach cancer can be tricky to spot early because its signs often mimic everyday digestive complaints. Watch out for things like persistent heartburn or acid reflux, trouble swallowing, nausea, frequent indigestion, excessive burping, or feeling full after just a few bites. These are common issues and most of the time they're caused by something harmless. But if they stick around, it's worth getting checked out. Other red flags include losing your appetite, unintentional weight loss, stomach pain, a strange lump-like feeling in your upper stomach, or extreme fatigue. If any of this sounds familiar, don't panic, but do talk to a doctor. Early detection can make all the difference. So here's the big question. Why isn't H. pylori a household name given its massive impact? And here's an even bigger one for you to chew on. Should we be pouring resources into global screening programs, even if it means diverting funds from other health priorities? Or is this just one piece of a much larger puzzle? I'd love to hear your perspective. Drop a comment below and let's get the conversation going. After all, when it comes to health, the more we talk, the more we learn. 4. Stomach cancer breakthrough. How a common infection causes 12 million cases. H. pylori alert. Shocking new research reveals that a widespread bacterial infection may be responsible for nearly 12 million future stomach cancer cases worldwide. But here's what most people don't realize. This silent threat could potentially be prevented with proper screening and treatment programs. The culprit? Helicobacter pylori, H. pylori, a common bacterium that infects the stomach lining. Experts estimate that out of 15.6 million projected stomach cancer cases among people born between 2008 and 2017, a staggering 11.9 million will be directly linked to H. pylori infections. The geographic distribution paints an even more concerning picture. Asia is expected to bear the brunt with 10.6 million cases. The Americas, Africa, and Europe will see millions more combined. Here's where it gets controversial. While the International Agency for Research on Cancer strongly recommends widespread screen and treat programs that could slash stomach cancer rates by up to 75%, Cancer Research UK presents a different perspective. They note that in the UK, stomach cancer rates are actually declining and H. pylori infections are less common, with lifestyle factors playing a more significant role in cancer prevention. This raises critical questions. Should global health organizations prioritize H. pylori eradication programs? Or are we overlooking more pressing cancer prevention strategies in different regions? The debate continues, but one thing is clear: understanding your H. pylori status could be more important than you think. What's your take? Should governments invest more in bacterial screening programs, or focus on lifestyle education? Share your thoughts below.